From KETK, you're watching East Texas Live.
Welcome back. It's Medical Monday and May is Stroke Month, and joining us now is Jennifer with Christus to talk about Stroke Month and why we should pay so much attention to it. How are you doing today?
I'm good. How are you?
I'm doing awesome. So what can you tell us a little bit about Stroke Month and why it's so important to spread awareness?
Yeah, so as much work as we've done in the stroke community, we still have a lot of work to do. There's 800,000 people annually that will have a stroke. 600,000 of those are first-time strokes and 200,000 are repeat strokes. Stroke is still the 5th leading cause of death in this country, and it's the leading cause of disability. So with all the advances that have been done, we still have a lot of work to do to improve patient care.
Yeah, so and what are some of the impacts that it has on people?
Yeah, so when you think about impacts, you know, that looks different depending on the family, right? So we typically think of physical impacts and the disability that comes with that, and people not being able to walk or talk and lose the ability to work. But there's also emotional impacts. I was talking to a couple recently, and the husband was talking about how he has to help his wife put on her swimsuit for hydrotherapy now. And so there's many different impacts, not just physical, but also emotional and relational as well.
Yes, ma'am. And we heard the acronym BEFAST. What can you tell us a little bit about that?
Yeah, so BFAST is really an easy way to remember stroke signs, right? And so the B, we think about balance and also dizziness. So typically these patients will come in and what they tell me is it feels like they're drunk when obviously at noon they haven't been drinking, right? But the E looks at eyes, and so it thinks about vision changes, and that could be anything from blurred vision, double vision, or also just cutting out parts of the visual field. Face, we think about facial drooping, so one side kind of drooping down, but it also can be a severe headache. So when we think about our hemorrhagic strokes, they will talk about the worst headache they've ever had, or some even describe what they call a thunderclap. So they can actually hear the aneurysm in their brain rupturing. And then we talk about arms. So A is for arms, but this isn't just the arms. It could also be legs because it's really dealing with weakness of the limb. So it can be somebody who drops their coffee cup in the morning or drops their plate when they're getting their breakfast, or their leg gives out when they're trying to walk. But it can also be like a sensory deficit, meaning that it feels like they've laid on their arm or leg all night and it's asleep when really it's not. They're having some sensation problems. And then speech. Speech can be anything from they can't get their words out at all to what we call word salad, meaning words are coming out but they don't make any sense, especially in the context of the discussion. Or they can have what we call dysarthria, which is slurred speech. And then T is time. So the important thing to remember with stroke is time is brain. And so the quicker that you call 911 and get to the hospital for treatments, the better your outcomes are going to be.
Yes, ma'am. What are some of the more modern ways to treat a stroke, and what kind of recovery can someone have if it's treated early?
Yeah, so, you know, for a long time we've had what we call thrombolytics, or the clot busting drug is what people refer to it as. And that window is out to 4.5 hours now that we can treat those. But over the past few years, we can actually go in if we see a large vessel occlusion or a very large clot sitting in a vessel. We can actually go in and retrieve that clot now up to 24 hours out. So we've been allowed to get the blood and oxygen supply going back to that area of the brain out longer windows. Obviously, the thing to remember here is the quicker you get there and we can intervene, the better the outcomes are going to be long term.
Yes, ma'am. Where can people learn more information?
Yeah, so obviously Christus Health website has lots of information about stroke, but another great resource obviously is American Heart and American Stroke Association.
Yes, ma'am. Well, thank you so much for your time.
Thanks so much. Thanks for having me.
Yes, ma'am. For more information, go to the website right there on your screen. Well, coming up later on East Texas Live, the UT Tyler School of Medicine is in the building to tell us more about their upcoming Women's Health Symposium. We'll be right back.